I'm Patrick Chinnery, the Executive Chair of the Medical Research Council, and I'm here at the Frances Crick Institute meeting colleagues from across the public and private sector, listening to their views about how we should shape the UKRI strategy moving forwards. So I heard a great deal this afternoon, but there were three standout messages that came repeatedly across the table from the stakeholders. The first is an enthusiasm for our strategy, and particularly the importance of thinking about the value and the impact of the research and innovation that we do for the general public. Secondly, that we have to do this together. We have to co-design our approach if we're going to be effective. Can't just be UKRI, can't just be the external stakeholders. We really need to work together to do this at pace. And the third, possibly even the most important, is to continue our commitment to train the next generation of researchers and innovators so that this economy can continue to flourish and grow beyond the next few years. So there was general agreement that there's a real opportunity for us to share our areas of investment to attract interest both in the UK and more broadly from other funders, both in the commercial and the public sector. This way there'll be a multiplier effect and we'll really be able to jointly deliver our aims. Another theme that came out was some uncertainty and concern about how these changes will be implemented and particularly some of the unintended consequences that might emerge from some of the activity that we're starting to explore together. But I think there was a recognition that by doing this collaboratively, co-designing it in partnership with strong communication in both directions, that we would achieve the intended aims. For the Medical Research Council, these kind of engagement activities are really important. It's a very complicated landscape with lots of different funders, lots of different beneficiaries, including the NHS, and it's crucial that we engage all of these stakeholders to make sure that our strategy actually will deliver from discovery research, such as here at the Frances Crick Institute, right through to translation, which could lead to companies forming and growing in the UK, but also shaping the way the NHS works so the health of the nation improves. So it was greatly appreciated that UKRI is taking the time to travel around the country and listen to people's views about our strategy for the future. And it was so good to come today to hear those ideas, because I realise that we as a research funder cannot do this on our own. We need to work together to find the solutions and deliver this at pace.